Good afternoon. Thank you all for joining us today for the first Title IX Advocacy and Support Panel discussion in honor of Sexual Assault Awareness Month. I am so excited and grateful to have three communities be part of today's discussion: the University of Michigan, Howard University, and Georgetown University. I want to begin by introducing our panelists and facilitators for today's discussion, but I want to first acknowledge that we're covering topics that include sexual assault and misconduct. We encourage everyone to take breaks as needed, to be mindful of your own self-care, to reach out to the confidential counselors at your institution, and to feel free to connect with the Title IX offices with any questions following the discussion. Because we are limited in our time today, we ask participants to submit questions in advance, and we have done our very best to incorporate as many of those questions and topics as possible in those that we plan to discuss today. So beginning with our panelists, from Howard University, I want to welcome Angie Logan Pope, who serves as the interim Title IX coordinator and Title IX investigator, Kevin Webb, who serves as a Title IX training manager, and Tiara Garnett, who serves as the advocate specialist interpersonal violence prevention program. From the University of Michigan, we have Elizabeth Seeney, the senior associate director and Title IX coordinator, and Karen Williamson, the director of the Sexual Assault Prevention and Awareness Center. From Georgetown University, Jen Little-Schweer, the associate director of Health Education Services and the director of the Sexual Assault Response and Prevention Services, and myself. My name is Samantha Berner, and I serve as the university's Title IX coordinator and director of Title IX compliance here at Georgetown. Finally, I want to introduce two Georgetown students who graciously volunteered to serve as facilitators for our discussion: Anna Gorski, a senior in the college, and Ben Tulersky, a sophomore in the college. Ben and Anna, I will now turn it over to you.
Thank you, Samantha. So first, our first question we have for you all is, we want to hear what some of you have to say about a brief reflection of the last year, particularly considering the new Title IX regulations that have changed. And even with the new regulations, what's something important that you think the community and the students and faculty and staff here should know? Angie and Kevin, do you want to start with this one?
Sure, thank you, Ben. So I will say, generally, I would say the last year has been challenging for everyone just around the world. So universities, I would say, we're facing not only the pandemic, but also tasked with implementing the new Title IX regulations at the same time while operating remotely. I think that many universities, including Howard University, handled these challenges very, very well. And I think that it's important for the community to know that the work of Title IX is obviously very, very important and very relevant still, and that most Title IX offices are still accessible and have been able to provide remote resources and assistance above and beyond what is required by the current regulations.
Yeah, well, and I'll just to add a little bit to that, I think seconding in terms of the new regulations, I think one of the most important things was making sure people in the community were aware, and faculty, staff, and students were aware that, as I think Angie alluded to, our new policy, because we had to rewrite our policy, was not limited to what the Title IX regulations said we had to respond to, right? That and making sure people understand that when we think of these civil rights laws, that usually they're setting the floor, the minimum standard of what an institution has to do in terms of responding to harassment and discrimination. So that was one thing, acknowledging the concerns people had about the regulations and the run up to their implementation, acknowledging that we as a university shared some of those concerns, and that was expressed in the comments that we submitted along with over 100,000 other institutions and organizations and individuals, and that our policy can and does go further in terms of providing protections from harassment and discrimination based on sex or gender than what the new federal regulations require. And so that was a conversation that we had. It was an ongoing conversation. It's a conversation that we still have, just in terms of making sure that everybody is aware of that, just to try to address those concerns.
I would agree with what Kevin and Angie have said. And I think reflecting on the challenges of the past year, I think the takeaway that I would want everyone to know is exactly that we're still here. Our Title IX offices and institutional equity offices across the country are, there's sort of two areas where I think people have had concerns about, will this work continue? And one is, as Kevin mentioned, in the run up to the regulations being finalized and released, we heard a lot of fears and concerns that they would be pulled back, and legal obligations that institutions have would be pulled back and limited in such a way that institutions really wouldn't continue to do this work. And so that's what I would want people to know, is that's not the case, that exactly to Kevin's point, the legal regulations set the floor, but the institutions represented on this call and many others across the country have continued to really robustly address these issues of sexual and gender-based misconduct in a way that's compliant with those regulations, but isn't necessarily limited or restricted to just behavior that falls under those regulations. And then similarly with the pandemic, that has caused people to have questions or concerns about, our office is open. I think at this point, that's less of an issue, but certainly at the beginning into last spring and into the summer months, there were a lot of questions about, our reports slowing down? Do people know that offices are still open? And so I think at this point, people know that everyone, whether we're on campus or remote, that work is continuing. But that's what I would really want to underscore, is that people can still report concerns. Those concerns are still being addressed. We're still following up. We're still implementing supportive measures, and our resource offices on campuses across the country, like those represented on this call, are still open, working, and continuing to serve our campus communities.
Yeah, I mean, I think a lot has already been covered. So I really echo everything that's been said. I also think a key thing that we're hearing about, and I think we're seeing in our reports, are questions about, like, does it matter if I'm not living on campus or I'm not living in DC? And how does that impact my ability to not only report, but get support? And so I think, as you all have said, really emphasizing to communities that we are here, we care. That includes the confidential counseling services, that includes the mental health support, that includes the Title IX office, interim supportive measures, all of those things. We're doing everything we can. And as you all have said, these regulations came out and they were challenging for all of us, our communities, our offices. And so we do have this legal obligation to comply, but we also have an obligation to support our community, to be responsive when things occur, and really to be mindful of how this is impacting our community and figure out the best way to continue that. And so you can tell from all of us on this call how much that is still at the very forefront of our approach. And so I'd really want people to walk away from this conversation understanding that we continue to remain a resource, regardless of where you are or what has occurred. And if you have questions or concerns, please don't hesitate to reach out.
That actually transitions well into our next question, which is about how offices and students have been impacted as all of these universities have transitioned to providing support through Zoom. So what can a survivor expect from your office if they disclose experiencing sexual misconduct over Zoom?
I'll kick us off at the University of Michigan. So I think I feel pretty lucky with our office when we went remote. We had already done some online meetings with survivors on campus. We have a pretty big campus, and folks on North Campus, it's hard to get to Central Campus sometimes. So we had already experimented with some online meetings, and thank goodness we did. So we just pretty quickly transitioned to all online meetings, and just really didn't skip a beat in terms of online survivor support and offering the same kind of advocacy that we've always offered. I think we just kind of transitioned right away to online kind of advocacy appointments, and then just figured out how to adapt all of our other, how do we do walk-ins? Is anybody coming to the office? Are they going to call? Are they going to come to our website? So we shifted our website a little bit and put a little button to just say, I want to make a meeting. And so we just sort of streamlined the appointment process for students. I think we also just started seeing some different kinds of cases too. We had more students who were at home, and so dealing with more family abusive kinds of situations, more online harassment stuff, right? Just our online life, how people's lives changed. We just adapted to what our students and our clients needed. I think we also, SAPAC is survivor support and prevention education. And so we have about between 150 and 200 student volunteers doing prevention education. And we weren't quite sure, like, how is this going to translate? And we started the year with 3 volunteer training groups, one on primary prevention, one on secondary prevention, one on tertiary prevention. And people just came along. People figured it out. Students just figured out that they still wanted to be connected. They still wanted to do this work in an online format. And we moved our 21-hour volunteer training to online, to an online class format, and people still showed up. So much so that we added 2 new volunteer programs by the end of the year. So it was one of those years I think we thought we were just gonna sort of skate by and get by, but actually there were some new things that happened and some creative opportunities that allowed us to meet the needs as we saw them and as they changed throughout our pandemic time.
I can jump in here. And a lot of what I'll say sounds a lot like what you just heard with University of Michigan. We're also an office, it's confidential support for survivors, also a prevention office, education. And so the shift immediately was to online services. How do we get things, our intake forms adapted to reflect this new, and to also communicate information around what to consider when doing a Zoom appointment, right? That's something to say, if you're at home in your childhood bedroom, or if you don't have your own space, but you want to call in, how do we navigate that? And so new forms, informed consent, intakes. So a lot of the day-to-day in terms of meeting similarly looked the same, but not. It was just on Zoom. We stayed connected to those students. I think where our office saw, we also were looking at both creative ways to engage, but also where are the gaps. And Karin, you mentioned this exact thing that I had written down earlier, which is the walk-in piece, right? A lot of our offices have folks who just drop in. They might feel like, I was walking by and I think today's the day I want to go talk to somebody. And so we're missing those opportunities, and we know that. I think for our office, we were perhaps seeing fewer folks come in as new contacts. Definitely though, seeing students who we'd been seeing trying to adapt, cope with these new traumas involving the pandemic, involving trauma they might have at home, on top of what they'd already been managing, staying with us and really relying on us to help them make that transition. So those pieces really look the same, creating a drop-in hour that's virtual for our colleagues. And this is, in making referrals to us to say, hey, there's this hour you can always drop in and somebody's could be available to speak to you. So trying to just set up a virtual office, which was a challenge, but that was the first order of business, if you will. And in doing that, then also engaging and really trying to up our social media presence, so students knew that we were still there and available, and we're here, just not in our office, and relying on our student workers to help us navigate where we should be, like which formats, how should we be communicating and finding students. And then our sexual assault peer educators, which have been a very big piece of our prevention efforts. What should that look like? We'd also had some transition in staffing. And so what should that look like? And landing on a model with fewer who were doing more and really felt more connected with one another, because a lot of our students both feeling zoomed out, but also isolated at the same time, not wanting to have to add 10 more things on at the end of an academic day, but really feeling isolated. So how could we do that in a way that felt more meaningful? So really focusing on those pieces, the education piece, but also even for our students and our SAPE facilitators who were not directly working with us for survivor services, making sure we were showing up to support them and mentor them in the same kinds of ways that were really important, that we were, so they weren't carrying the load of doing really hard work virtually on their own. So I want to pass it off to my colleague at Howard, but just wanted to sort of echo a lot of that, and that was kind of the process of what we thought about it, making that transition.
Hi, everyone. I am Ms. Garnett, again, from the IBPP office at Howard. In regards to providing support for the students at Howard, we've always had a pretty good presence on social media. We have an Instagram account, we have a Twitter account, and we understood that that was the best way to keep the students engaged. So we've always had a really good presence on there. We do programming, so we kind of made a transition from doing on-campus programming to a lot of virtual events. And we found that it would be best to team up with other student organizations as a way to pull in the engagement from other students. And we also transitioned from, of course, those walk-in hours and those in-person sessions to Zoom sessions. But another thing that IVPP does that's a little different from other universities, we actually provide our cell number. So if a student needs, if there's a crisis or a student needs advice, or they just need a moment where they need to cry or to vent, they do have the option of giving me a call. They can text me. Students can email me. We have some students that'll send me a direct message via social media. So we have all of these different avenues so that we can meet the students where they are. And I think that it works really, really well. I have a lot of students that prefer to text first, just to kind of build that rapport, and then they'll be more comfortable doing a Zoom call, or some students would even prefer just to FaceTime. So we do FaceTime calls as well, and I just document everything, but definitely increasing that social media presence, I think, is the best way of building that rapport with students and getting those new students that we would typically miss because of the lack of walk-in hours. Just making your presence a little more known via social media definitely helps.
Thank you all. This next question sort of builds a bit off of what Karin said earlier about new kinds of cases, but Samantha, starting with you, from a Title IX reporting perspective, how has the work changed in the last year with a predominantly remote campus? Have reporting numbers changed? And what types of incidents are being reported now? And are virtual cases handled any differently than in-person cases?
Yeah, really great questions. I will try to cover all of them, but hold me accountable if I miss any. So we have seen a change in our reporting numbers. I think particularly last summer and fall, when we had most students and community members off campus, we definitely saw a drop in reports. I would like to hope that that's because there were fewer incidents of misconduct. That's obviously a hope and not something that we yet have data to show. But I also think you just had fewer community members that were close by. And so they may not have felt that they really should be reporting to the university or could reach out to our resources. So I know we mentioned before that those are absolutely still options, but I think that that's something, especially as everyone was kind of learning how to navigate this new environment, that people just were questioning. They weren't exactly sure, if I'm living in another state with my parents, what should I do if someone from high school has no affiliation with my university hurt me in some way? Can I still talk to someone in health ed or a similar confidential counseling office? Can I still report to the Title IX office and get interim measures or supportive measures? And so I think as more students are kind of getting used to the remote environment, but also staying connected to the institutions, I think those questions are being answered more naturally. And so we are seeing reporting numbers going back up, which is not necessarily something that I think any of us want to see, but it also, I think, reflects that students and community members are coming back to using us as a resource, which I think is really positive. In terms of the types of cases, so I think in a typical year, we would see a higher number of sexual assault cases. I think over this last year, we've seen more of the online sexual harassment that was mentioned before. We're seeing increased cases of dating and domestic violence. I think just that is a national issue as more people are home with a family member or a partner. And then we're also seeing an increase in our stalking cases. And I think that there's definitely social media and online tracking that's used there, but also kind of in person. And so that could be just mental health issues are on the rise, given just the environment we're all living in. And so that has escalated it in some ways. But we're seeing higher rates of those and fewer rates of sexual assault, which is different than our traditional year where you have most community members on campus. And then in terms of whether an online case is handled differently than one that happens on campus, the simple answer is no. So anyone could still report to the university. You could still get those interim supportive measures. You can still talk to a confidential counselor. You still have formal complaint options. The process might look a little different depending on where it happened or who else might be involved. And that goes back somewhat to those Title IX regulations. But as we've all mentioned, our policies cover beyond what just Title IX does. And so we continue to remain a resource, and there continue to be options regardless of whether something happened online or in person or off campus.
I would echo some of that for Michigan. So it's interesting in some ways. I feel like the work really has changed. I mean, the most obvious and immediate change is that we're interacting over Zoom now instead of in person. And I think there's some definite drawbacks to that. And I think that there are sometimes some ways that people can feel more comfortable with that. It can create a little bit of distance for someone who might have felt intimidated about coming into an office where they haven't necessarily been before and sharing an account of their concerns. And I think in some ways that can be positive. I also think in hearings, we certainly had some real challenges. Jen referenced earlier the kind of different dynamic of having people at home where they couldn't necessarily always walk into an office and have a space there. And so we ran into some issues with hearings where we had to get really creative about where people could have privacy and have a private space to be participating in a hearing or an interview with an investigator over Zoom, particularly if they were living at home or with a large number of roommates and didn't have a lot of private space. Now, I think that we don't have so many stay-home orders and things. It's much easier to find those spaces and to work with people to help them. Karen's office has been fantastic about helping create spaces for people to go to participate. So those are some changes. And I think sometimes people can feel more comfortable if they do have the private space, feeling like, okay, I can be doing this from the comfort of my living room or my bedroom or what have you. So, I mean, that's certainly a significant change. I think some of those things will continue to hold over for quite some time. We have seen some changes to reporting. What strikes me the most, and I actually think this is a combination of pandemic and regulations, is we've seen less of a change in our overall numbers and in the types of conduct reported, although we certainly have seen a little bit of that. But what's the most striking to me is that reports involving concerns regarding faculty and regarding students have gone down compared to this time in 2020, but concerns involving staff are higher than they were at this time in 2020. And the reason that I think on our campus, at least, that's a combination of the pandemic and the regulations is in terms of the pandemic, it really reflects kind of who's on campus. So we have a large health system. And so, of course, those have been essential workers who have continued in large numbers to be on campus and working closely together under very stressful situations. And we've continued to receive those reports. Regulation wise, we have much more, so an increase in reports because of the direct contact and the direct involvement that our office has with cases involving patients that we had less direct and immediate involvement with in the past, and then also collective bargaining unions. And there were some collective bargaining agreements on campus where there were other processes laid out in that now we have more direct involvement in those cases as well. We had more tangential involvement before. And so I think it's a combination of those two things that are affecting those report numbers for us. But, you know, certainly I would say that is a change, but the overarching, and to your point, Samantha, the overarching how a case is handled and what options are available for resolution continue to be very consistent, even though some of those nuts and bolts of whether we're meeting in person or on Zoom may have changed.
I'll jump in there just very briefly. I guess the beauty of going last is everyone has already covered everything for you. But just a few things. I will say that we're seeing more family reports or reports that are stemming from family interactions or from students just being at home. And we had not seen very many of those types of reports before the pandemic, but of course that is the nature of our circumstance of everyone being remote. I will also add that we used Zoom prior to going remote, prior to the pandemic. So we had already had that component integrated into our office and into our practices. But of course, we're using it so much more now. And I do think that, again, as was previously stated, there are some positives and some negatives to that. And one of the positives, I think, is just generally people who may have been reluctant to report before are now more comfortable to report from the privacy of their home and things of that nature. One interesting fact is that we've seen an increase in male complainants coming forward now, and they feel more comfortable, you know, conducting interviews via Zoom. So I'll just add those tidbits on to that.
Thank you, Angie. I really appreciate that. For the next question, we wondered what types of support and referrals are available for a survivor. So specific to working with other offices, how are referrals managed?
I can jump in really quick. So our referral process for the IVPP office, because we still are a confidential non-reporting space, so our referral process has pretty much remained the same. We would typically make the referral to the Title IX office if the student would like to file the report and like an investigation. But we do have other confidential resources on campus. So you know, it's a case by case basis, but based off of what the student expresses their needs are, that would determine the type of referral that I would send out. However, I will explain to the student, once this referral is sent to this department, they have their own process, and you know, their process may look a little different from what you have experienced in the IVPP office. However, I still provide support even if I make the referral to another department. I still will remain their advocate throughout the entire process. So if a student expresses a concern, I would likely reach out to that department and to see if we can kind of make this a smooth transition. But like I said, once that referral is sent out, that department has their own process. But everything is the same documentation is just a virtual document now.
And at the University of Michigan, I would echo it's the same, like we're just doing the same things that we've always done in terms of support and referrals for our clients. And we work with students, faculty, and staff in terms of what we offer an advocacy support. And so we are also a confidential office. So most of the time people come directly to us or referred to us. Or we reach out if there is a report that comes to Title IX, and we also reach out and provide confidential support. We also have a 24/7 crisis line, a phone number. And so we do have folks answering the call around the clock. And so sometimes people will call in the middle of the night and we will get back to them the next day. I think one of the other things in terms of the kind of support that we created this year is that we teamed up with our counseling office, which happens to be across the hall from us in the student union. And we had been in our new office all of about 2 months when we got sent home. But our SAPAC office and the Counseling Center for Students is on the 4th floor of the Michigan Union. And we decided to team up and to really create a seamless support for survivors between our office and the counseling office. There had been a lot of requests for, we want therapists in SAPAC. And we kept thinking, well, they're right across the hall and they have specialized training right over there. But it didn't seem to be accessible. And so we launched a new website, a new sort of program to market the joint survivor support services that we have between our advocacy office, our prevention office, and our counseling office, to sort of say, here's all the confidential support. Some of what we do may look, similar. We both can do some emotional processing, but the advocates can help you through the hearing process and the investigation, and do academic advocacy and housing advocacy, whereas your CAPS counselor can offer you therapy, ongoing therapy. They have therapy groups, right? We have a peer-led support group. So it just, we teamed up to just make it clearer and to make referrals back and forth a little easier. So we have more now of an internal referral system instead of front desk to front desk. And that's created a lot more of accessible support to students and trying to lower the barriers, right, of people seeking help, so that once they get into one of our offices, they're sort of tapped into all of the resources. And that's a relatively new thing, again, just from this year, but that's been a helpful evolution this particular year in terms of our resources.
I love that. And it's such a good example of the ways in which things that we do now can also be carried over post the Zoom world, post the Zoom, exclusively the Zoom world. So I echo everything that my colleagues just shared, and I won't restate them. What I'll add is that I think one of the things in terms of, our referral process has been the same. We have the same, maybe I'm not going to a meeting with a survivor, but in person, but I'm going to the Zoom meeting with them. So I'm still there. We still have them, they still have confidentiality, and our releases are just online. So if they want me to advocate on their behalf, we just do a release online for that. So those things really look the same. And honestly, I think has been maybe the least amount of transition in those processes, because the relationships are already there and formed, and we're all living in this world of Zoom. I would say two things. One is just an increase in working. We've always worked in consultation with faculty and staff as they've supported their students. An increase in how that looks when faculty might say, hey, I don't know if this is a report. It's just something I think I saw on a Zoom square, but I can't be sure, or I'm not positive, but I'm a little worried about my student based on something I'm seeing, or the screen being on or off, so just that new dynamic of navigating how to support students, or just, disclosures, or what they think might be happening based on what they're seeing online. The other thing is that a big piece of our work is always this, but it looks different in the ways that part of our role is to help survivors navigate and find options. And so whether it's an external resource for legal services or therapy, our job has really been through this pandemic is to understand how everyone else is handling their online processes and their Zoom processes. And are these therapists in person, or are they not? And can they see this student based on where the student lives, or can they not? And so I think that has maybe been one of the more, I say challenging, but it's just been different. We always do that, and figuring out, like, if you call this number, this is what will happen next, but that looks different for every single community agency that we're working with right now. So I think that is probably where we've seen some of the change, but and also we've relied a lot more on national resources in terms of pushing those out and supporting our students, because our students are all over, national and international resources. They're all over the world. And so we can't just assume that what will work for them living in DC is going to be the same, or even that the same kinds of regulations or laws or limitations apply in terms of the services they can get. So I think that's probably one of the big pieces as I think about how referrals have changed, that it's been about our role in managing that information has changed.
Awesome. So looking forward to the fall semester, what are your expectations for access to Title IX during the Title IX office during the fall 2021 semester? What are your ideas for interacting and engaging with students, especially this fall with so many more students being totally new to the campus environment this fall. So Elizabeth, do you want to start on this one?
Sure. Yeah, I think we'll continue with a lot of the things that we've already talked about on this call in terms of remaining available and trying to broadcast that and communicate that information broadly to the community so that people know that they can continue to access the office and other offices on campus. A couple of things that we're doing currently that are new for us are, one is we've just started virtual office hours. So we have not had a ton of walk-in kind of foot traffic in our office historically. We're located in a little bit of a good news, bad news kind of off the beaten path kind of place. So that might be why, but we have had some ongoing conversations about, we have this big campus that's a little bit spread out amongst North, Central, and South Campus. And so having more of a presence on particularly North Campus, we're on kind of the South Campus adjacent to Central Campus. And so that's something that we decided, let's not wait. And in fact, while it's maybe more important than ever to have that. And so while we're remote, and so we've started virtual office hours that people can kind of sign up for. We've got obviously a queue so that there's privacy in place. So we've just started that actually in the last week or two. So I'm hoping that that will go well and that people will use that and take advantage of that, of a way that they can just talk to staff in the office, learn about options, ask questions, whether it's because they have a specific question or experience that they want to potentially report, or a process they want to know about, or whether they just have questions about what happens when something is reported, or what are the supportive measures that can be put into place. And then the other thing is, for the first time, we're starting a Title IX Coordinator Advisory Committee with subgroups for undergraduate students, graduate students, faculty, and staff, so that each of those populations can be represented on this committee and have kind of separate times to talk. I'm hoping that will be a really two-way exchange of information and hear feedback from the community, as well as opportunities for the larger group to meet together. So those are some of the things that we're doing that are kind of new to us, but I think a lot of it is just continuing to make our presence known and the options that are available known in the ways that we have, whether virtual or in person in the past.
Yeah, I'm happy to share. So we're doing a lot of the similar programming that it sounds like you all are at the University of Michigan. So we continue to host office hours. We used to do that in Levy Center on the main campus, and I've transitioned to virtual office hours, as it sounds like it must be kind of a pattern among office locations. Our office too is located kind of towards the edge of campus in Darnell Hall. So we didn't typically have a lot of walk-ins, but I do think the virtual office hour space allows not only for someone to know in advance when the option is there, but similarly to register, you'll get a Zoom link, you'll have privacy. And it's just a way, it doesn't necessarily have to be like something happened and I want to report. It could just be, hey, I heard this and I seemed confused. Could you talk me through, is this true? Is this really what happens? It could be you're trying to help a friend, you just want to educate yourself, but it's just an opportunity also to get to know us. And so we're continuing to try to work with campus partners that are doing work with students. I'm hoping that as more students return to campus, we can continue to partner with some of the student organizations like the Black House, Casa Latina, things like that, where we really want to get our names and our faces out there to reach more communities and more students, rather than just those that we love having them, but that are kind of around us all the time. We also want to expand who knows about us, and make sure that they're aware of their options and resources. And so one of the new programs we're launching in the fall is the Title IX Ambassador Program. And so we had undergraduate students, it's a pilot program, volunteer, and we're really hoping, similar to, it sounds like your advisory committee, that it's a two-way street. So we can train them and give them a lot of information about what does the process look like? How do you navigate the new regulations? What has changed? What hasn't? What are the resources? What are the options? But we can also learn from the students directly about like, hey, this idea you had is working and this one isn't. We need to figure out another way to get this information across, or this would be a really great way to connect with students. So I'm really excited, and I'm hoping that it's the start of a program similar to this conversation, where it's just another way to reach students in a different way rather than just a formal setting like a training, or because something's happened, but more in just a natural way where we're trying to get to know you and hopefully you can get to know us and build relationships.
Yeah, so we, in terms of Howard, we of course are anticipating returning to campus physically in the fall. Of course, we all know over the past year, plans have come and gone. And I think about a year ago, I was thinking, okay, we'll be home for a couple of months and then we'll be back on campus. And here we are a year later. But when we return to campus, I think we will start to do some sort of a hybrid model where we will, resume some in-person meetings, but still probably be doing a lot of, virtual meetings via Zoom or other, otherwise meeting online. In terms of just meeting with people, who want to reach out to our office. And then someone mentioned an advisory committee. So we actually did also start a student Title IX advisory committee last year. That's made up of a number of students who've been really helpful to us in terms of bringing the concerns and the questions that students have for the Title IX office. And also, a lot of the things that we want to communicate to the student community in terms of education and awareness, being able to help us share that out through utilizing their social media. I mean, they all are connected with student organizations, including student government. So they've given us lots of great ideas in terms of how students consume information, how students communicate. So it's not just putting something on your website, but if no one's going to come to your website, it doesn't really mean anything, right? So how do we, do we tweet something out or send something out through a student organization's social media, related to things that students have questions about? What do I expect? What can I expect when I report to the Title IX office, for example? And what's the best way to convey that information? I mean, for example, students mentioned things like infographics. And so we produced one, just basically illustrating the reporting process and what happens and what they can expect in the adjudication process, and other information that can be shared with students, also partnering with student organizations to participate in events that they're doing. And another thing we'll probably continue is also leveraging community events, right? There are lots of community organizations that we've worked with that are doing work around gender-based violence and discrimination, harassment. And so particularly, for example, this month for Sexual Assault Awareness Month, in addition to participating directly in events like this, we've also let members of the community know about other events that are happening in the community that they can be a part of, especially as we're not on the same campus. So these are things that they can all participate in from home and take part in what's happening during Sexual Assault Awareness Month. And I think that's the kind of thing that will continue as well. And then even as we return to doing things like trainings or events in person, I think that what we've learned is that this just, being able to meet virtually just adds another tool or adds another venue for us to meet that can make it easier. I mean, we've done a whole lot of training, maybe even more training over the past year, because people don't actually have to physically get up and go somewhere. Or if you want to bring a guest speaker in, they may be willing to do something for free if they can sit in their room and do it via Zoom rather than have to travel to your campus, and you don't have to pay for them to travel. And it's a way we can all connect a lot more easily. So I imagine that, or I anticipate that a lot of that will continue in terms of leveraging the ability to connect online and share information online. And again, particularly, partnering with student organizations and, leveraging the ways in which they're able to communicate with large numbers of students. And it's works a couple of ways, because we get the feedback from them about what students want to know, what their concerns are. And we're able to share information back and answer the questions, respond to their concerns and questions. So I think that sort of hybrid approach of being, face to face, as well as using online and virtual means to meet and exchange information and raise awareness and educate, I think that'll continue going forward.
Absolutely. Thank you so much, Kevin. So we saw that in August, we experienced Title IX regulation changes under the Trump administration, but we wanted to know what changes can we expect under the Biden administration regarding Title IX.
So I'm happy to start us off, and please feel free, anyone else, to chime in. So on April 6th, the Biden administration announced an executive order that essentially outlined that the Department of Education would be conducting a comprehensive review of the Title IX regulations put in place by the former administration, those ones that Anna just mentioned that were implemented last summer and fall. So they outlined plans to solicit the public's input on the regulations, in addition to reviewing the hundreds of thousands of comments that were submitted during the public notice and comment period in 2018 and 2019, which it sounds like most of us on the call contributed to, with the anticipated outcome of making revisions to the existing regulations. What those revisions are, we're not quite sure yet. But we are anxiously waiting to see what they look like. So we still are waiting to learn what exactly the revision process will look like. It can go a number of ways based on kind of the legal requirements, since they are regulations, not just guidance. And because of that, we anticipate that it will take some time, but we, again, aren't exactly sure how long it will be before they issue some guidance or even new regulations. So I know that we, and I imagine all of my colleagues on this call, are monitoring this very closely. And so I imagine that when there are announcements, each of our communities will be able to communicate that and let you all know what the updates are, as we learn more information and understand how the new announcements, whether it's guidance or regulations, impact our communities and our policies.
I'll just add that there was also a webinar last week by It's On Us and End Rape on Campus that is posted on at least the It's On Us web, Instagram, and I'm sure other social media, which breaks down a lot of into detail the pieces that Samantha just covered too, in terms of timeline, the expectations, what has been committed to so far, including hearing session, or not hearing, listening sessions, if you will, and conversations with survivors and advocates and allies and others who are impacted by this, and all of the ways in which we've been talking about. So that's something I would just also reference, that I feel like was broke it down in a way that I think was helpful in taking a very complicated executive order and with a lot of uncertainty, and just giving some sense of what we might expect in the next 100 days as they conduct their review of all of this.
I think we have time for maybe one more question before wrapping up a little bit. So something that I know a lot of students are very passionate about is restorative justice. And I know that one benefit out of the new changes from last year was that it gave more room for universities to add restorative justice techniques in their mediation processes. So I'd love to hear more about what restorative justice principles you're incorporating into your Title IX programming now and moving forward.
Jen, I'm happy to start off if you want to add in from your perspective. So we actually, through our Office of Student Conduct and through student support, there has been kind of this working group, and I'm using that term loosely, but a working and learning group that has formed this past academic year that has really allowed faculty, staff, and students to come together because they've expressed some sort of interest in restorative justice. So it doesn't require that you have a lot of experience. It doesn't require that you've gone to a training. It's really just, hey, I heard about this and I'm interested in learning more. And that has been a really positive and impactful group. I think it's bringing together a lot of different voices, which I think in order to make a shift in culture, which I think is a big part of what restorative justice aims to do. It's not just how do you handle one specific complaint or case, but how do you really shift the culture of a community to making this part of it? It's natural. It's restorative justice is just built in. And I think this is allowing us to hear from different people that are doing this work to really learn and better understand what it looks like. Within the IDEA office, we also have a restorative justice coordinator, a student who is working with us to really educate us. So doing research, what are other schools doing benchmarking, what's working, what isn't working, how does someone start from the ground, and how do you get to where we really want to be? And so I think all of those are really good signs. And I think having students be part of the conversation from the very beginning is really how we're going to make a change in our community. I think there's a lot of great work that we as faculty and staff can do, but I think really to get us over the hump and into where we want to be to really make change, you need students to not only be part of the conversation now, but also be part of the implementation. And I think being able to work together from the start is something that will really help us. So I don't have a very clear or specific, like, we're going to do this by this date, but I can say that this is something on the forefront of our minds, and it has been for a while, but with these new regulations, I think it kind of really spelled out that, okay, we can do this and we have more flexibility. And so I think there's a lot of positive movement to come in this field.
I will jump in very quickly because I know I have colleagues on this call who actually institutions have really implemented the restorative justice pieces. And just want to say, along with that, there's been another conversation happening amongst a couple of offices in which we're looking at, when we talk about restorative justice, which is actually different than mediation, and the mediation piece, restorative justice in and of itself really encompasses so much more, which is about that reducing harm, empowerment, and community engagement, and how that looks. So there have been conversations about that in lots of spaces for a while, because it's separate from that idea of mediation, which tends to be what Samantha mentioned, is that like direct in one case, and there can be some imbalances of power, and that can look different. So one of the things that we're doing, our office along with some other colleagues, are having conversations about right now, what can sanctions look like that meet those principles of reducing harm, helping heal, empowering community engagement, and empowering communities now as we move toward a model of implementing restorative justice, knowing that it's a lot of work in an area of expertise in and of itself. So I also would say that bridge between what Samantha talked about and where we want to be is we're very intentional in thinking about how we can implement pieces of that as we're looking at the bigger picture. But I want to stop so we can hear from schools who I know are implementing it.
I'll speak very briefly on that as well. We are too in the exploratory phase of restorative justice, as with Georgetown. But I would like to point out that we have been trying to get creative with sanctioning as far as education, like educational programs, having some alternatives to what traditional Title IX sanctions might look like. So, anything from community service or healthy dating and relationship classes or courses, or just, things that, like you said, would change the community, change the culture of, just more of a broader issue, not just an issue that occurred between two people. Like we see that this is maybe a cultural issue and we need to try to shift the culture. So we were looking at those types of things in addition to exploring restorative justice practices as well at Howard.
So I'll say it's always funny, and I'm going to hand it over to Karin really quickly. It's always funny talking about restorative justice with Karin on the call, because as the Title IX coordinator, I'm used to jumping in and talking about what resolution options we have available. And and my cat is joining us, so that's great. Karin is like a restorative justice national treasure and has tremendous expertise in this area. So it's always a little funny. So all I will say about it is that we have really, really great folks in our Office of Student Conflict Resolution that are facilitate this, very, very skilled, also national treasures in this area. And so I feel really lucky that we've been able to offer this. And of course, it's expanded over the last couple of years, particularly now and following the 2017 guidance in case resolution. But I also feel like we're in a place of exploring how else we can use restorative justice practices. And we're very focused on culture change right now, as many institutions are. And I think it's so valuable as a tool for that. And then I will let Karin add anything as important.
Thank you so much, Elizabeth. I think what I would just say is that Michigan, I've only been here for 3.5 years, and in a previous life, I was also a Title IX coordinator, and I tried to do that from a restorative justice lens. And it is a different kind of lens, the different approach to harm that adds another lens of harm, not just policy violation, right? And Michigan has been offering restorative justice for student sexual misconduct. We call it adaptable resolution since January 2019. So all forms of sexual misconduct are possible, right? Students who are harmed can request adaptable resolution. Elizabeth, as Title IX coordinator, has to approve of that, and the respondent has to agree, and the restorative facilitator has to agree that more harm isn't going to come from the adaptable resolution process itself. And I think we're in conversations about whether this extends to employees. We know the current regulations prohibit the use of restorative justice or informal resolutions for cases with a faculty or staff respondent and student complainant. And that has caused a lot of concern among some of my restorative justice colleagues around the country, because that's often where folks are looking for it, right? And part of the reason I see its potential is it just increases our options for people who want to report, who are looking for something, but don't necessarily want an investigation or hearing. And so we can actually increase our possibilities for stopping the behavior, preventing the reoccurrence, and addressing and remedying the effects of the misconduct. So there's a lot happening nationally. I think there are lots of folks who are interested in this nationally. Separate from Michigan, I am co-chair of the Campus PRISM project, the Promoting Restorative Initiatives for Sexual Misconduct. And we have people reaching out all the time, looking for, how do we start this? What do we need? How might we learn more? So that's one sort of exciting part for me in this moment, is that people are looking for other options. How might we add something for people for whom a hearing and an investigation was never going to be what they wanted? And so I see this as a way to sort of increase our ability to affect change on campus and address people's harm in the way that's most appropriate to them. So thanks for that question. That was a little surprise for me. That was a nice way to end. Thank you.
So I know that we are coming up on time. So I just want to thank you all again for attending today's session, the Title IX Advocacy and Support panel. We are so grateful to our attendees, the panelists, the facilitators for your participation today. We truly hope that this is a start of an ongoing conversation and dialogue between all of our institutions and communities. I think it is clear that we can all learn from each other and work together, which is really great that we've kind of started this now. As a reminder, we encourage you to connect with confidential counselors at your respective institutions and to reach out to your university's Title IX office with any questions or concerns. So with that, thank you all, and I hope you have a great evening.